Talking about chiropractic adjustments, because you're a chiropractor, and it's one of the tools that you utilize that maybe other practitioners would not. What are you seeing as the influence when you take a child, do a spinal evaluation, and adjust their spine?
So there's so many ways to answer that question, because chiropractic care does have many different components. There's an energetic component of laying on of hands. There's an intentional component of the doctor and the patient relationship. And then there's the actual physiology of what's happening. I mentioned before that if we were to go back 10,000 years, right? Anywhere on the planet, go back 10,000 years, and it was probably a harsh environment. And that harshness gave us one of two situations: extreme health and fitness or death. Realistically, if you were kind of lazy, overweight, and pre-diabetic 10,000 years ago in New Hampshire in February, you're probably going to die. Now, understanding that and saying what were the environmental triggers to make you extremely fit and healthy, and using that knowledge in applying it to our health is a good idea. So temperature variations, cold exposure can be good because we adapt to that. Yeah. Heat exposure is a good idea because we adapt to that. There's something called heat shock proteins. Heat shock proteins are produced when you're exposed to heat because we don't want the heat to kill us, so we adapt to the heat. Applying some kind of a stressor to the body, hoping for an adaptive response, is a good idea. Whether we're talking about cold, but we're not going to stick them out into the wilderness in Alaska, maybe we'll use ice therapy in some fashion or another, or cryotherapy. We'll use a sauna instead of sticking them in the desert, right? But now with chiropractic care, we also adapt to physical challenges. And maybe we can put a very specific physical challenge on the spine called a chiropractic adjustment, where the body recognizes that challenge and adapts and creates a better positioning and a better function of that specific area that the chiropractor said this needs to be addressed. So that's kind of a micro stressor that will not hurt you, that can only help you by creating an adaptive response.
In your view, does it impact brain function?
Without a doubt. And the reason I can say that with confidence is because there's a part of your brain right back here called the cerebellum. It is the primary driver of this part of the brain where we have our personality and our intellect and our cognitive function. You shut down the cerebellum, you will shut down the frontal lobe. And the primary drive to the cerebellum is your muscles and joints, how you move in your environment. And the most active of the muscles and joints neurologically are the ones that are most midline. The most midline muscles and joints are our spine. And the higher up, the more powerful. So it's more powerful in your neck than it is in your lower back. It's more powerful in your lower back than it is, let's say, in your hips or your knees. So that's the neurological benefit of improving how your body responds to the gravitational environment.